Hi, do you ever get pain on the very low part of your back, as low as you can get close to your buttocks area, or off to the side close to the spine in your buttocks, or even out towards the side of your hip? If so, this could be coming from the gluteus medius muscle. Hi, I'm Dr. Catherine Price. I'm a physical therapist, and in this video, I'm going to go over trigger point release of the gluteus medius muscle. This muscle is commonly overlooked with lower back pain. If you're an athlete that does weight-bearing sports or a runner, walker, anything that's going to be weight-bearing and requiring you to use your legs and constantly be in a weight-bearing position, or even if you are sitting for long periods, sometimes this can be a problem. Medius can also be a problem in developed trigger points if you have a leg length discrepancy. So if you have a difference in leg length, whether it's a muscle imbalance or actually an anatomical difference. You can also have problems in the gluteus medius muscle if you have a sacroiliac dysfunction or SI dysfunctions. So I want to go over origin, insertion, and action of the muscle and how to do the trigger point release. So how to find the muscle: if you go to your hip, go to the top of the hip bone and then the very front of the hip bone. This muscle is going to be just under that crest bone, and it's going to be along the 3/4 of the front side of that iliac crest. So it's going to be right along there. My back side fibers are going to be underneath a part of the gluteus maximus, and then my front fibers are going to be more superficial. And what this muscle does, it's going to flex the hip, it will abduct the hip, bring it out to the side or the leg, and then it's going to internally rotate. So it will lift the leg, flex the hip forward, and then internally rotate the hip. Now there are posterior fibers, those ones that are underneath the glute max, that are going to externally rotate the leg, but mainly we'll think of the gluteus medius as internally rotating, flexing, and abducting the hip. It goes from that top of that front side of the iliac crest and attaches into the greater trochanter. That is that bony part on the outside of your leg. So it's going to span from just under that crest to the greater trochanter. And if you are getting pain in the lower part of the back, in that buttocks close to the very lower part of the spine and next to the sacrum, or radiating out towards the side of the hip, sometimes this can come from that gluteus medius muscle. So to release the trigger points in that muscle, I'm going to use a single lacrosse ball. I'm going to use my body weight. So once I locate the muscle, finding the top crest, going right underneath, it's kind of like a fan-shaped muscle, and then it's going to attach to that greater trochanter. I'm going to release trigger points that are just underneath the crest. So I'll take my single lacrosse ball, I'm going to place it just under the crest, and I want to lie directly onto my side, my back leg. I'll keep my foot flat on the floor, and I just want to rest onto that area. If you've never treated it and you do a lot of weight-bearing exercises or haven't addressed this muscle, it can be incredibly tender. So I'll apply my body weight onto that area, and then I'm going to just roll so that I am going all along that underneath portion of the iliac crest where the gluteus medius is located, the muscle belly. And so I want to pull my hips backwards, and then I'm going to push my hips forward. Now, one thing that I like to do, I've worked on this muscle for a while, so once I find my trigger point too, I will then, to intensify and to get more of a release, bring my opposite leg up so that I am going to change the stretch to the other portion of my pelvis. But if I leave my leg here, I can also go through a running movement, or so I'm bringing my leg up and then bring it right back down, and that is just going to help me move through tension as I'm applying pressure on that trigger point. I'll hold it for 20 to 30 seconds, work on that area for about 2 minutes. Alleviate the trigger points in that gluteus medius. And then to stretch it, I can then stay right here, and I can push my body up so that I can get a stretch through the side there. And if I'm standing, I can take that leg and I can keep it behind me, and then I can bend my body towards the opposite side till I get a stretch through the gluteus medius muscle here. And then to strengthen it, I can lie onto my side, lift my leg, internally rotate, flex my hip, and just hold that there, activate the muscle to get a contraction there. And I don't want to do that if I'm having pain. So first I want to reestablish the muscle-tendon relationship through the trigger point and fascial release, and then stretch it to restore the length tension relationship. And then I can strengthen it if I'm not having pain. So if you are having pain when you are walking, jumping, running, or even lower back pain when you're sitting, sometimes it can be the gluteus medius muscles, so that's a great place to investigate to see if that is the case or not. But I do recommend having a consult with your physical therapist or healthcare provider to find out what your problem is and what is going to be the most appropriate exercise for you to be doing. I hope this is of help. Have a blessed day.